Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. What do we have here in this image? It's a histopathologic section, right? H&E stained. And we see this inflammatory infiltrate in the left inset. And to the trained eye, you can recognize an abundance of neutrophils. We're going to be discussing this and much more in this lecture on meningitis pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code and get to the website where all the updated material is. And with that, let's rock. Meningitis is a term for inflammation of the leptomeninges. And the leptomeninges are made of 3 layers: the dura mater, the arachnoid, and the pia mater. The meninges are located between the brain and the skull. Regarding meningitis, the leptomeninges is used as a collective word for the pia and arachnoid. And meningitis is typically caused by an infectious disease such as Listeria or Streptococcus pneumoniae, Neisseria, Haemophilus, Coxsackie virus, or fungi. And specifically, there are certain associations that frequently show up. So if you're in a timed situation where you need to make a choice, remember this. If a neonate has meningitis, think Listeria monocytogenes, E. coli, or group B streptococci. If an adult has meningitis, think Streptococcus pneumoniae. If it's a child or a teenager with meningitis, think Neisseria meningitidis. If it's an unvaccinated infant with meningitis, think Haemophilus influenza. If it's a child who's been eating their own poop, talk to their parents, talk to social workers, and think Coxsackie virus. And if it's an immunocompromised patient, think fungi. Okay? That's in last minute situations where you haven't quite figured out what's what. If you have to make a last ditch choice, that might help you. Now, some symptoms of meningitis include headache, nuchal rigidity, fever, photophobia, vomiting, and altered mental state. And also, there are 2 classical physical exam findings that you should be aware of. They're eponyms. Do you remember them? Kernig sign and Brudzinski sign, right? Ring a bell? And with Kernig sign, that knee extension is painful, right? And with the Brudzinski sign, neck flexion leads to knee extension, right? You remember that? In regards to meningitis, a lumbar puncture by you, if you're a future anesthesiologist, a lumbar puncture is the diagnostic procedure for sampling of cerebral spinal fluid to assess for meningitis. And a lumbar puncture is performed by inserting a needle typically between L4 and L5 at the level of the iliac crest. And keep in mind that the spinal cord ends at L2, but subarachnoid space and cauda equina continue. The CSF findings in meningitis depend on the specific cause, right? For fungal and viral infections, we tend to see increased lymphocytes, but for bacterial infections, we tend to see neutrophils, right? You will be asked that, so keep it in mind. Look at that. For bacterial meningitis, we will see increased neutrophils. And those neutrophils, they go around and they eat up the glucose. So you'll see decreased glucose. The causative organism may be identified by gram stain, polymerase chain reaction, or even MALDI-TOF, which is matrix-assisted laser desorption ionization. A culture may be useful as well. This is all done by microbiology, which is under the umbrella of pathology, right? So future pathologists that go into microbiology, this is you. The majority of the time, bacterial meningitis has complications. And what about viral meningitis? Well, we see increased lymphocytes and the glucose levels will be normal. In fungal meningitis, we see increased lymphocytes and increased glucose. Now, some potential complications of meningitis include death due to herniation, secondary to cerebral edema. You can have seizures, hearing loss, and even hydrocephalus. And with that, we completed a short but highly tested lecture. Great job. You keep making me proud. You're learning so much. You're reviewing so much. Keep up the good work. I'll see you next time. Ciao.